Thank you for joining us for the fourth annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
I think it is extremely important for patients to be their own advocates, both with regard to shared medical decision making with their clinical care team, but as well as with regard to public advocacy and organizing into groups such as the AAKP and other groups around the world to really have that voice to policymakers and other stakeholders that, this is our situation, this is what we hope for to live, better, more productive lives, longer lives. And this is what it's going to take to get there. It's going to require a certain amount of funding and investment by governments and other sorts of foundations. So I'm all for patients being their own advocates, both, on the micro level with regard to their individual healthcare decisions and in the shared decision-making model with their clinical team, but also on a macro level, on a more, policy level. And there have been great strides, and certainly the AAKP has been at the forefront of that advocacy on behalf of kidney patients. The field of kidney transplantation has really advanced over the last several decades. And of course, kidney transplantation is the preferred therapy for patients reaching end-stage kidney disease, both in terms of quality of life of those patients after they receive a transplant, as well as longevity of life. So all that being said, there are still unmet needs in kidney transplantation, as you've alluded to, and I think one of the most basic unmet needs is the availability of enough kidneys. Chronic kidney disease and end-stage kidney disease are growing in prevalence, and there simply aren't enough kidneys, either from deceased donors or from living donors, to keep up with the needs of patients suffering from end-stage kidney disease. So kidney availability is certainly an unmet need, and a lot of folks are working on this and promoting, living donation, and educating on living donation, as well as looking at how the deceased donor allocation is conducted. There are some very innovative approaches to dealing with this kidney shortage, including xenotransplantation, which is when a kidney from a non-human species is transplanted into a human with end-stage kidney disease. And most commonly, we hear about experiments with genetically altered pigs, and there's some excitement around the possibility of using, for example, pig kidneys in patients. We already use, animal-derived tissues for other things, such as, a pig valve for patients who need a heart valve surgery. So, but that field is still pretty early, and it holds a lot of promise. But in the meantime, I think that increasing awareness about living kidney donation, the realities of it, as well as looking at the kidney allocation system and how we can reduce the time spent on waiting lists for patients are major unmet needs. So the second piece of my response to this question has to do with the immunosuppressive therapies that we use. So without a doubt, the immunosuppressive therapies have become increasingly sophisticated and have prolonged the survival not only of the kidney transplanted organ, but also of the patient. But they do come with some baggage and some side effects from having to lower a patient's immune response so that they tolerate the kidney. So further refinement of immunosuppressive drugs to minimize these sort of less desirable secondary complications such as infection and malignancy and so forth is another area of unmet need. I do still practice nephrology, and the patient is always our true north. So everything we do in developing new therapies for patients suffering from various forms of kidney disease, is in the service of those patients as our true north. And the more we listen to them, the better and more impactful we can design the clinical trials. For example, it's not uncommon for industry to design very detailed and informative clinical trials that are logistically difficult to execute, or perhaps not very desirable to participate in from a patient standpoint. And having our patients, input as early on as possible not only helps us understand what matters most in terms of their disease experience and to guide us in how to measure, whether a treatment has an effect or not, but also guides us with regard to whether the trial is, something they'd want to sign up for, something they'd want to sign a family member up for, or if the assessments are too invasive or too time consuming and so forth. So really, it's become increasingly clear to me that patient involvement, not only to understand their disease experience and their journey, to inform, what's important to them with regard to clinical endpoints, is very important, but also whether or not a trial is something that they would want to sign up for or sign a family member up for, or if we've designed something that's unenrollable. Sanofi has a long history in the kidney space, starting with a disease called Fabry disease, which is an inherited lysosomal storage disease that results in the buildup of a fatty substance called GL3 in multiple cell types and multiple organs. The kidney is one of the principal organs affected by the buildup of this the buildup of these lipids. All cell types of the kidney are affected in Fabry disease and in the classical form. And prior to dialysis, kidney failure was the leading cause of death for Fabry patients. Now, we've been successful in researching the disease through various collaborations with investigators, through the largest global patient registry of Fabry patients that there is, as well as in the development of therapeutic options for these patients and management guidelines. So we have a history in I guess we would call it a rare or genetic kidney disease, and supporting patients throughout their journey, understanding the disease, understanding how we can intervene and best practices to allow these patients a better life. And we've extended that commitment in so-called rare nephrology or genetic nephrology. Usually rare nephrology means genetic nephrology. We've extended that commitment to other disease areas and have been involved in diseases such as autosomal dominant polycystic kidney disease and Alport syndrome. And we continue to reaffirm our commitment to developing therapies for rare nephrology conditions, and to better understanding these conditions. Now, developing new therapeutics is a risky business, and sometimes you succeed and sometimes you fail. And all of my colleagues in industry will tell you that drug development is not for the faint of heart. But despite any programs where the therapy didn't work as we expected it to, we remain committed to serving patients in this space and to try again. So we're building a real portfolio of potential therapies for patients with rare kidney diseases, many of which have few or no therapies. Thank you. So this is a really interesting and striking finding from this survey conducted by the AAKP. And I mean, it's nearly uniform that the survey respondents would want to participate in clinical trials and drug development, as long as they felt valued and felt as though they were partners in the process. It's really very striking. Yet we as a nephrology community are clearly not doing a good enough job in reaching out to these patients for these trials. And all, clinical research is not only fueled by patient involvement, but it's for the benefit of patients. So fixing this is of the utmost importance. So I think that patient empowerment with regard to their knowledge of therapies in development is very important. And I know AAKP and other patient advocacy organizations, both in the US and outside the US, have really stepped up their efforts in trying to raise awareness of the various trials that are ongoing for various kidney disorders, and in some cases have matched a patient's profile with a potential trial they may, for which they may qualify. And so that's a great start. The patient advocacy groups working to connect patients to potential trials. I also think that, simply asking your nephrologist if they're aware of any trials in the disease area into which the patient falls is very powerful. If they are not, they certainly have the resources to look such trials up online through clinicaltrials.gov, other professional websites. But that should also, not prevent patients themselves from looking online. We live in the information age, and nearly all clinical trials can be found somewhere on the internet, either through a clinical trial register once they're actually initiated. So both in the United States and clinicaltrials.gov, as well as in Europe through UDRA-CT. In addition, these trials are listed on patient websites. They have standalone websites. Google can be powerful to find trials that are ongoing and that patients may qualify for.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.